I think we were both on the road out seeing patients. We started to get a lot of emails and started making phone calls to figure out how this was going to affect us in home health.
I do a lot of patients in assisted livings, and so we were kind of trying to determine if the assisted living was going to still allow our home visits or if they were kind of locking out all staff. Some of the staff was turned away from the doors saying like they weren't allowed to visit and we weren't allowed to care for our patients. But quickly we got that kind of figured out. And in November, we did do our first BAM infusion in the home, and I went out to go do that. And we make phone calls the next day, and the patient was so thankful and so appreciative that they didn't have to be in the hospital, they could get this medication. And so that was really, the patients were very appreciative of that, and that was nice.
For our testing team, we all came together in lots of phone calls, lots of emails, so that we could make sure that we all felt supported and we worked together. We didn't, that decreased my anxiety. We would figure out a time that we were going to meet so that we could all go through it together.
Yeah, and it was things we've never really done before. So, the first few times the paperwork that we had to fill out for the health department, and where did that paperwork go after we filled it out? And so we kind of worked through it together, and yeah, I think that we grew closer. As staff. And some of those patients too that had a hard time with technology, we could use our phone and FaceTime their family, and so they could actually do a FaceTime call with their family during our visit, and the family could be a part of, our assessment and talking with the patients. And
I think one of the things that, Lisa and I talked about is we have a lot of elderly patients, a lot of people in assisted living that were not able to see people for a very long time. So the fact that we were able to go in with our proper PPE and actually have contact with the people that are so isolated. There was a point where their food trays were sat outside of their door and they had to go get it. So they had really, really minimal contact. So that was really nice to be able to go. And I feel like now I realize how important our job is.